week, we told you about Yeastie, Beasties, those embarrassing health problems that sometimes might happen to you, like health or bloating, gas, that kind of thing. Well, Dr. Mikell Parsons from the Naturopath Health Center is back to tell us just how to get rid of those Yeastie, Beasties, which you call them. I love that. Okay, first of all, explain to us what exactly Yeastie, Beasties are.
Yeast is essentially a candida infection is probably the most common species that we deal with. And it likes damp, moist surfaces. So it's something that happens inside of us. It happens in body folds. Even that athlete's foot is a form of a yeast infection.
Oh, so it doesn't always happen to women?
No, it can happen to men as well.
Okay.
Yeah, it doesn't care if you're male or female. It just wants the food and the damp conditions.
All right. So how, first of all, I want to ask, how do we get rid of them? And second of all, what are some of the symptoms that may not be so obvious?
There's a lot of symptoms. There's a laundry list of symptoms. But for women, sometimes PMS can be a sign that there's an underlying yeast infection. You know, for women, we've talked before about, you know, the common classic symptom is a vaginal yeast infection, but it could be anywhere, and it could also be systemic throughout the whole body. It's a big cause of that brain fog, huge cause of fatigue. And we don't often associate a yeast infection with that. We're looking for something local that we could see. So for some people, when it's internal, it could increase your likelihood of food allergies. It can cause weight gain in some people. In someone else, it might cause weight loss. It just causes this body disruption. And if it's not addressed, it doesn't go away on its own. That's the downside. It won't spontaneously resolve.
Well, it sounds like you won't even know that you are suffering with a yeast problem.
Many people who come into the office, they come in because of some other reason. And during that initial assessment, you know, because I'm a detective, I like to figure things out, I'm like, this is a yeast issue.
Well, how do you realize, how do you come to that conclusion?
Part of it with me is just clinical experience. I've seen it and I've battled it, and I got really angry years ago because I was tired of fixing it in people and then having it come back. So I really dug in and looked at what type of environment does it like. So if your body pH is off, if you run more acidic, which is typical with the typical standard American diet, which is sad, you're going to have the wrong body pH that's actually going to promote yeast growth. So sometimes
diet has a lot to do with it.
Huge, huge component to the growth and removal of the yeast.
Now, you have some supplements with you.
I do.
When someone comes into your office and says, you know, I'm extremely tired all the time, or I have bloating, what's the first thing you do? Well, first talk to us about the supplements that you have here.
There's a lot of different yeast killers. And because there's so many different species, there's not one yeast product that's going to kill everyone's yeast. Okay, so there's not one size fits all treatment.
So you can't just take, what is it, pomegranate vitamins, or what is...
Pomegranate vitamins?
No, pomegranate vitamins. What am I talking about?
I do not know.
Help me out here. What they always say, the juice, the cranberry juice.
Cranberry juice? No. In fact, juice is going to feed the yeast.
Pomegranate, cranberry, kind of the same thing.
You just had wine.
Exactly, a wine-filled chocolate. This is what happens. So this is something that we can take.
Yes. That's
obviously natural, or is it what's in there?
Well, it is a process. Okay. Some of these are processed, some of these are herbs. It just depends on the company and the type of species that we're going after. But you also have to do the dietary change. If you just do one and not the other, if you just do the dietary change and don't back it up with a bug killer, it's probably going to come back. And if you don't change your diet, yeast loves all the yummy things that we like. So if something tastes really good to us, it does to the yeast too. And they're like, yay, feed me some more. Love it. And they're good at making those yeasty babies.
Oh, well, yeah, I'm sure they are.
They know how to do that.
So when someone comes into your office, what's the first thing that you do to them? How do you assess them?
First thing I do is ask a lot of questions. You know, we kind of go over all the different symptoms in the body. There's some testing that I can do in the office through muscle testing to help narrow down, kind of localize. There could be a rash or something physically on the body that we need to take a look at. And then from there, I can literally within seconds come up with a treatment protocol designed for whatever issue is going on with you. And that's something that really is important, because if you're wanting to do a weight loss program and you're stuck and you're doing all the right things, even though you're on a healthy program, if you have that underlying yeast infection, it's going to be tough. Your yeast are not going to let you lose weight.
Is this something that children might suffer with as well?
Yes, children are equally susceptible, especially if they're eating more of the sugary types of foods and you know, just have that different type of diet that's going to promote yeast growth. So yes.
Do you find that people think it's maybe too difficult to just change their diet? How difficult is it to change somebody's diet once they're so accustomed to eating a certain way?
Part of the trap that people fall into is, I can't get off sugar. I have to have my sugar. You know, my world revolves around sugar. It's not you. It's your bugs wanting you to eat the sugar. So it's understanding that you are literally in a battlefield. You are at war. Those bugs are manipulating you into eating those foods. Now, it's hard to just say, well, I'm not going to eat it. I know I'm at war. You've got to back up and also do the bug killing part of it as well.
Okay, so that'll solve a lot of problems, including bloating, gas, fatigue, you
Absolutely.
said, all the symptoms. All right, if people want more information, please call Dr. Mikell Parsons at the Naturopath Health Center, 447-1404. You could also visit her online at naturopathfresno@yahoo.com.
And we'll do that special that we've done in the past. If someone really wants to know, come on in. We'll do it, an assessment. We'll charge you $50, and we'll rock and roll.
She just wants to get you healthy, everybody.
That's right.
All right, thanks so much for being here, Dr. P. We'll see you again next week. That's it. Bye-bye, everybody.
Sorry about that.
Oh, for no.